Welcome to In Focus with Ejaz Haider. Tonight we revisit the COVID-19 challenge starting at home. Prime Minister Imran Khan spoke at the inauguration of the first facility in Pakistan that can produce ventilators. He also spoke about reforming the health sector, the government's policy regarding smart lockdowns while keeping the economy afloat. Separately, he has also spoken to the Director General of the World Health Organization and raised the issue of coronavirus-related travel restrictions on Pakistan. But while the government praises its strategy, critics are not really convinced. That's one area we will talk about. The other related topic of discussion is the role genes play. Last month, researchers compared people in Italy and Spain who became very sick with COVID-19 to those who had only mild infections. They found two places in the genome associated with greater risk. One is on chromosome 9 and includes ABO, a gene that determines blood type. The other is the Neanderthal segment on chromosome 3. But these genetic findings are being rapidly updated as more people infected with the coronavirus are studied. New data showed an even stronger link between the disease and the chromosome 3 segment. People who carry two copies of the variant are 3 times more likely to suffer from severe illness than people who do not. We will ask our expert panelists to put this into English for us. So let's get right to it. We are joined by Faisal Sultan, who is the Prime Minister's focal person for COVID-19 strategies. We also have with us Dr. Munir, who is a virologist at Lancaster University. Thank you to both panelists. Let me begin with Dr. Sultan. Dr. Sultan, thank you for being on the program. As I said, that critics have lots of points with reference to the approaches taken. One of the criticisms was about a certain nonchalance which was manifest in federal government's approach to the crisis that began unfolding in Pakistan. The Prime Minister said on more than one occasion that this isn't much worse from flu. Lots of other officials have since been saying that, well, you know, this was a new thing and we didn't really know about it. And we are only learning as we go. Now, that's surprising because, as you know, being a medical professional, that since at least 2008-9, there has been a lot of discussion about the coronaviruses, and lots of people have talked about this emerging threat. So just give me a sense first of why initially there was this approach of taking it lightly and not really going in for a lockdown earlier.
So first of all, this impression is completely incorrect. Let me put some evidence in front of you to tell that. At no point did any official communication from the government treat this as dismissive or something that did not require attention, or that something that really did not merit a public health response. On the contrary, the Federal Ministry of Health formed a working group which met every day in January. This is well before, many weeks before even the first case that got detected within Pakistan. This working group worked out of the Ministry of Health, was chaired by the Minister, Dr. Zafar Mirza, had experts sit on it, myself included, had representation from various civil and military entities to ensure that there was complete coordination and synergy. The initial focus, of course, at that stage in the pandemic was inflow. And so the focus was on inbound travelers and passengers and treating and quarantining them. But to be honest, the fact is that this pandemic evolved with time, and it required an evolving, adjustable, and flexible response. And that is what's been evidenced all through this time. I can give you more examples, but I think, you know, in a nutshell, at no time did any official of the government treat this as light or as something that did not merit attention.
Okay, right. One thing I can confirm to you, I was returning from Singapore on 26 Jan, and there were people with the temperature guns. So to that extent, yes. But when I said that there was a certain nonchalance, I would request you to go back to 2 earlier speeches by the Prime Minister in which he talked about this being no worse than a flu. And so, let's not be very concerned about it. Now, this is a matter of record. Yes, there was the committee. I completely agree with you. But nonetheless, as far as the lockdown is concerned, the real lockdown, that began pretty late. But having said that, let's move on. Now, Sindh is, and I was looking at its occupational hazard, I have to do this, is looking at the charts and graphs provided by the government on the official page, where Sindh is showing a spike. But that is because Sindh has ramped up testing, whereas in Punjab and Khyber Pakhtunkhwa, testing has been brought down. Now, why is that? Is that because we want to not allow, figures, the real figures to appear?
Let me first correct something you said. You stated that the lockdown occurred late. I would submit to you that the lockdown actually occurred fairly early. In fact, if you count from the first day of the day of the first case, we were amongst the earlier countries to lock down. So I think that's a factual and a fact-checkable item. So I would really urge that you go back and look at it.
Okay.
Now about the statistics. Look, the fact is that at any given time, when tests are reported, they are reported out of 100 different labs, and they are referred into there, the people are referred into there through literally thousands of interactions, which range all the way from an individual walking up to a lab, an individual going up to a doctor and being referred to get tested, as well as from a hospital. So this is not a number that can be dialed up or down. That's part one. That's where people come and get tested for symptoms. Anybody who arrives and has symptoms and wishes to have a test can't be denied it, and you can't really drag people off the street and say, well, come get tested. So my contention is that those people that are getting tested for symptoms are a natural phenomenon that you cannot dial up or down through any intervention. There is, however, a second part, which is contact tracing, and I do agree with you there that that could certainly be improved or enhanced, and I think we should be doing an ever better job of it. So as far as the numbers are concerned, they not only reflect, this is not just testing numbers, they reflect the situation on the ground. If you ask anybody, any health professional in all the major cities, they will tell you very clearly that the pressure on the health system that existed in the early part of June or until mid-June is not the same as it exists today. The fill-up of the system is at a fraction of what it was relative to what it was 2 or 3 weeks ago. And that jives in perfectly with the numbers that are coming through.
Okay, forget about for a moment that you're the Prime Minister's focal person. As a medical professional, give me your sense of whether we should have gone for, you're right, I mean, you can't just pick up people and say, but there are countries like South Korea and others that have gone in for aggressive testing in the sense that, for instance, our office has been working. We took our own precautions here in terms of, how many people there are going to be in the studios, or how many people are going to be in the newsroom and the rest of it. But the offices that were working, the government could have said, right, we're sending in a team and we want all those people who are working in those workplaces to get tested. Now, do you think that was something that we could have done and we missed out on doing it?
Far from me, a lowly Pakistani infectious diseases physician, you should look at what the experts, the global experts, are talking about. And the testing regimes for a PCR test during an epidemic solidly and squarely list out the situations in which you need to test people. That testing regimen has evolved. At the outset, this was focused and targeted towards people returning from so-called high-risk areas. It evolved into areas as they expanded, as the numbers expanded in other areas, and eventually this became pretty much for anyone with respiratory tract symptoms. And that is the regimen, that is the testing regimen that we have followed. And that hasn't been devised by me alone. It has actually been devised by a set of infectious diseases physicians and experts, as well as laboratory experts, who sat together, looked at the international guidelines, and came out with the situations in which this ought to have been tested. What you are referring to is workplace testing. And I think barring very, very organized countries functioning at an extremely high level with enormous resources, that kind of workplace preemptive testing has not been done almost nowhere outside perhaps those few exceptions that I'm referring to. So I think for a developing country like Pakistan, where we were ramping up our testing capability, to deploy it in the most useful situation was what ought to have been done, and that was exactly what was done.
Dr. Sultan, I partially agree with you. I mean, the thing is, yes, we've got our constraints, but look at the list of countries put out by the European Union, where they are allowing people to actually travel to the EU countries. And they include, Montenegro, they include Algeria, Morocco, Uruguay, Tunisia, even Rwanda. So anyway, I'm not going to belabor this point. One other thing, we saw in June, of course, we saw spikes. And it went up to about 7,000 cases a day and averaging about 4,000. Now, that was because of the Eid opening up. Now, another Eid is approaching. And I'm assuming that, if we do not really go for social distancing and some kind of lockdown, that post-Eid we will again witness a spike. Is that a fair assumption to make?
Right. As far as the European Union is concerned, we took up that point with the WHO yesterday. It isn't data-driven, and it is not based on the number of cases, tests, deaths per million, and so many other parameters that we have. And in fact, the WHO agreed for the need for a more holistic, data-driven system of travel. Anyway, so as you said, not to belabor the point, I completely, totally agree with you that if we do not behave or take care of our precautions and the government does not enforce precautions, I think we certainly run the risk of the kind of spike that we saw post the earlier Eid. I think this is a crucial point for us. It seems to us that perhaps the epidemic is waning, but if we let this opportunity go of continuing our SOPs, our precautions, I think we run the risk of having a second or bigger spike even.
On that, Dr. Sultan, one about the Prime Minister talked about reforming the health sector. So one good thing that has come out of this challenge is to realize that a sound healthcare system is crucial and is actually part of national security. The other thing is about signaling as a leader, because where the Prime Minister is, where his team is, you people are watching you, and they emulate you. So for a long time, the Prime Minister won't wear a face mask. So that's not the kind of signal that one would want to send out to other people. So do you think that further communication in terms of precautions and the rest of it are important in order for people to understand that this is something which is crucial not only for their personal health, but also for other people that they contact with?
I could not agree more. I think signaling matters a lot. People watch not only what you are saying, but what you are doing. And I think, therefore, the signaling and adoption of precautions and appropriate actions by the entire leadership and those that are in positions of influence matters tremendously. I think that we sometimes, as individuals, perhaps underestimate the reach and influence that some of us have. And of course, anybody in true high leadership or top leadership, of course, has an exponentially high influence. And I completely agree. I think that signaling needs to be, strengthened if it is required in any area. But nevertheless, I think there is a realization of this, and there's no doubt about it.
Okay. Thank you so much, Dr. Faisal Sultan. Talking to you, let me go over to Dr. Muhammad Munir, who has been listening to this very patiently. Dr. Munir, as I said in my opening, chromosome this and chromosome that. You need to sort of translate that into English for us.
Thank you very much. First of all, Ejaz, for having me on the show. It's been a long when we've spoken last time.
Yes.
I think it is really important to understand that since the beginning of this pandemic and previous pandemics as well, one of the factors that remain very obvious is that why people are disproportionately affected. Some people are affected more than others. then we really drill into many of the environmental factor and societal factor that make them more predisposed to the infection. But then there are other factors such as genetic factors. So genetic factors remain one of the most challenging part to really drill into and make a correlation, especially when the situation is evolving so quickly. So in the beginning, one study that has been conducted on a relatively limited number of patients who were critically sick with COVID-19, this group came up that ABO gene locus within chromosome 9 is an association, which means that the blood group A carriers are more risky than O group. So therefore, it was quite a bit of discussion around that. But when the number of patients who were critically sick with COVID-19, they were added more into the data set, that effect was pale. So we didn't see strong correlation with ABO gene group. But now the study that appeared recently is about the 3p21.31 locus that is located onto chromosome number 3. That is really strong because what we see is that there is a strong correlation between disease severity versus the occurrence of this gene mutation within that allele on chromosome 3. So it is relatively a complex area of research, but one thing I would like to emphasize is that societal and environmental factors are more important in containing this infection than the genetic itself. And currently, there is no any genetic test that could tell you clearly that someone is more likely to be getting severely infected than other. But this is an evolving area and very interesting area to explore in near future.
I found it fascinating, frankly. I mean, I am a layperson. I don't particularly understand this, but what I find really fascinating is that, something that goes back 60,000 years, I mean, if you look at the lifespan of an individual, which is maximum even with now longevity, would be 80 years, perhaps 90 years at the most. 60,000 years is a long span. It's difficult to understand. And something that happened 60,000 years has come down to us through generations long after the Neanderthals became extinct. So when we talk about the genome studies and the rest of it, what exactly are we? Because my impression is that we have over the years, frankly, advanced quite a lot in terms of understanding this. But it seems to me from what you're saying, and correct me if I'm wrong, my sense is that there's still so much that we do not know.
Yes, absolutely. This is an evolving area, and genetics is one of the most complex discipline in biomedicine to really make a clear correlation between the genetic association versus the severity of any disease, infectious disease or other genetic issues. And one of the fundamental problem is that you have a very confined trait within that disciplines. But coming back onto this specific locus, which is P21.31, it is really important to understand how this gene evolved. I mean, Neanderthal, who've been the human before us, before Homo sapien, we are carrying at least 2% of our genome came from Neanderthal. And having this gene associated with the Neanderthal, that is really something very important when we look into the current impact of the COVID-19 onto different gene population. For example, if we talk about Africa, so far we haven't seen that disastrous impact that what we have seen in Europe and Southeast Asia and or now in Latin America. So what are those really genetic factors that are contributing? Because when we look into the evolution of the human, basically, we can't ignore Neanderthals and also Davisons. Those are the humans before even Neanderthal. So putting all of these genetic traits into context can really guide us into the important factors that could contribute into the severity of the disease. And this is not just to look into the current perspective. If we identify a specific trait that is responsible for the severity of the COVID-19, we can define some tests. So someone can perform a simple test that tell how much likely is that you will get a severe infection. And also translating that information, we can make better vaccines that work better across different populations. So it certainly has evolutionary perspective, but also moving forward onto the control strategies as well.
Okay. Dr. Munir, you said something very interesting about social inequality that also matters. For instance, in the United States, research shows that the African Americans are far more likely than the white people to become severely ill from coronavirus. Now, as a medical professional, tell me, how does social inequality work, to the disadvantage of a patient? Is it because he or she cannot get access to healthcare? Is it because of some nutritional issue? What exactly is it?
I think this is certainly very important and is a currently hot debated area for not only on the political side but also on the research side. In the United States and here in the UK, one of the group that has been adversely affected has been the BAME, which are basically Black, Asian ethnic minorities. And there are certain factors in there. I think the major contribution into the severe consequences of COVID-19 in BAME group is really the social racism and the difference in the living style. For instance, if we look into the UK, 50% of Bangladeshis, they live in multiple occupancies, which mean that people living in a very confined environment. And 30% of the Pakistanis, they live in a very confined environment. Overall, if we look onto the healthcare workers, 30% of the nurses came from BME group in the hospital. So altogether, they are environmental factors, societal factors that are making the BME group more vulnerable to this infection. And this has been one of the major criticism onto the government, both in the United States and in the United Kingdom, to really make enough efforts not only to reveal what are those factors that are making these population vulnerable, but also to ensure that they are equally treated as that of white peers. And one of the things that you hinted is really onto the access to the social care. Majority of the BME groups, they live under different social structure, and whenever they need, they are the last in the queue to acquire health at the earliest time points that make them also getting severely sick from the COVID-19 compared to their white peers.
Absolutely. Thank you so much. That's Dr. Mohammad Munir speaking with us. We shall take a short break and return to discuss Afghanistan, which hosted an international peace conference yesterday. Stay with us. Welcome back to In Focus with Ejaz Haider. We move on to the virtual international conference hosted by Kabul on Monday, titled Strengthening Consensus for Peace. 19 countries participated in the conference, including Pakistan. In its statement, Pakistan emphasized the importance of a peaceful and stable Afghanistan for overall peace and stability in the region and beyond. Pakistan also said it hoped the release of prisoners will be completed soon as per the peace agreement, to pave the way for the earliest commencement of intra-Afghan negotiations. That has remained a sticking point in the latest development. The Afghan government says it is reluctant to release 597 out of a total of 5,000 Taliban prisoners as part of the Doha deal. Head of the Prisoners Release Affairs, Ahmad Rashid Totakhel, says these individuals are accused of dreadful crimes and moral issues. Totakhel said they included individuals charged with murder, rape, and other crimes of serious nature. Taliban reject this assertion and say that the government is violating the Doha Pact by punishing individuals arrested on charges of just being a Taliban member. So far, 4,015 Taliban prisoners have been released. Let's get to the discussion. We are joined by David Sedney, who is a senior associate at the Center for Strategic and International Studies. And we also have with us Pardes, who's a journalist and based in Kabul. Let me begin with David here. David, what exactly was the purpose of this virtual conference which Kabul hosted yesterday?
The so-called peace process, and I say so-called because there's been really no peace so far, but rather there's been increased violence in the last 3 months since the withdrawal agreement that the United States signed with the Taliban, has lost momentum. A lot of people are questioning whether it has any real substance to it. And so this was an effort by the Afghan government and the U.S. government and other governments who support it. I think all the regional governments have been publicly supportive of this process. They were trying to inject some new life into the process, some sense of momentum, and probably trying to put some pressure on the Taliban as well to get them to move forward. Because so far, as I said, the process has not begun. The promised intra-Afghan talks that were supposed to begin on March 10th have not begun. There's been a lot of back and forth about these prisoners. Unfortunately, this whole prisoner thing was something that was promised by the U.S. but never agreed to by the Afghans. So it was never a commitment by the Afghan government. So the U.S. government has been pressuring the Afghan government to deliver on prisoner releases that the Afghan government never agreed to. That has now come up against the problem that there are a large number of prisoners who are accused of, who most Afghans believe have carried out some really horrible crimes. And releasing those prisoners at this time is something that I think it will be a very difficult political move for the Afghan government unless there was some really serious movement towards peace. But right now, more Afghans are being killed now than before this so-called peace agreement that was signed in February.
David, your view about the talks. We have discussed that before on this program. But here's the thing, and as I mentioned this before also, this process, and not exactly the best thing that could have happened, we can agree on that, nonetheless, was the only track that was followed. And so I also agree with you that this commitment was given by the US and not by the Afghan government. But then, frankly, I mean, the entire thing was being discussed between the US and the Taliban, and that was what the Taliban always wanted. And since there was no win on the ground, that was the only way that the US could negotiate with them. So this was a wicked situation. I believe that when Zalmay Khalilzad, Ambassador Khalilzad was here last time, which was, a few weeks ago, he seemed quite upbeat about the whole thing. And this release has to happen because that's the only way to get to the intra-Afghan talks and then for the Afghans to take up everything and figure out how they want to move forward on this.
I think that you've made some assumptions there. Particularly the one that this is the only way to move forward. That's not clear. And the other part of this is that the prisoners that the Taliban are seeking to release, releasing those will be a severe political cost to the Afghan government. And if the Taliban deliver on real peace and stop violence and have a ceasefire, then I think those releases could take place. But right now, there's a great deal of doubt. I mean, very, very serious doubt here in Kabul and elsewhere in Afghanistan that the Taliban will deliver on those peace talks. They will deliver on a ceasefire. What's been happening over the last several months is, in addition to attacks on Afghans, there's been a campaign of assassinations of intellectuals, activists, and I would say more moderate mullahs by apparently the Taliban. This campaign of assassination is something that is injecting a great deal of hostility towards the idea that these talks will move forward. So this effort on Monday to inject new momentum into the talks and to put more pressure on the Taliban, whether it will actually work or not remains to be seen, but I think it had to be done. I agree with you that this is right now the only game in town, but these are serious games. Lots and lots of lives are at stake. Lives are being lost every day here. And if the Afghan government were to release these prisoners and not get peace, not get ceasefire, not get intra-Afghan talks, then the situation would be much worse, much more dangerous than it is even today.
Faisal, frankly, making assumptions based on whatever set of facts we want to pick up and analyze on the basis of that. Now, you mentioned these assassinations. The Taliban have not taken responsibility for that. There were previous attacks that were actually traced back to ISIS, but there was a lot of talk in Kabul about the Taliban having done that. Anyway, I'm not going to belabor that point. Stay with me, David. Let me go to Mr. Pardes here. Mr. Pardes, give me your sense of the conference and the prisoner release.
I think exceptionally it is difficult that we would reach to a sustainable settlement in a country if neighbors are trying to tear apart. And the Afghan peace process has entered into a very crucial stage. And also, I mean, the yesterday conference and also today in Kabul, the regional countries are all set together and trying to find a consensus on peace in Afghanistan. And in Afghanistan, without an inclusive peace deal, I'm quite sure that the level would significantly increase, and it would growing the regional war and also trigger the humanitarian crisis, as David mentioned, and also, most importantly, it would raise a very serious questions about the reliability of the United States. So I think now the Afghan peace process has been entered to a crucial level and a good chance created, and all the entities who are included, United States, the Afghan government, and all the regional powers, they should seize the historic opportunity and trying to seize this opportunity to reach to everlasting peace in Afghanistan. And the last point, I mean, the Afghan government already released a very big proportion of the Taliban prisoners. And so it is scheduled that, I mean, we are very nearby to, I mean, in the coming days, we hope that the intra-Afghan talks start between Afghan government and the Taliban. Obviously, some grievances are still remaining, but all sides, I mean, for now, at the time being, trying to, or they must try to resolve the grievances and to push to start the intra-Afghan negotiations.
Mr. Pardes, let me ask you another question. I know, David has already said this in this segment also, and previously I've had discussions with David Sedney on this. Is not particularly, convinced about the way the U.S. went into this. What is your view of President Trump's decision to withdraw troops and to sit down with the Taliban? Do you think that was the only option left, or do you think there were other ways of going about it?
I mean, honestly speaking, at the time being, for the time being, we don't have another, I mean, alternative that without a peace deal, as I mentioned earlier, the situation would be more and worse, and the United States must, and the Afghan government, and also, most importantly, the ordinary people. Every day, the Afghans, they are losing their life, and unfortunately, Afghans blown up, mistakenly shot dead, and every day they are losing their life. So, I mean, at the time being, for all the sides, for the United States, for the Afghan government, and also for the Taliban, the very good solution would be to start very soon the intra-Afghan negotiation and also find a very solid way to, I mean, that we have peace and stability in Afghanistan. Without that, I mean, if, God forbidden, the peace process has collapsed and we not witness of starting the Afghan peace negotiation, so the situation would be get more worsened, and I mean, the United States will lose a lot of things. The Afghans are already losing their lives. The Afghan government also will trying, I mean, now the ground reality is that every day the Afghan forces, I mean, the Taliban already start their offensive. They are attacking the Afghan forces. So, I mean, if in summary, I can say that all the sides would lose a lot of things, But the good thing would be that all the sides seize the opportunity that's created now, and we hope so.
I agree. Thank you so much. That was Hadith Pardes speaking with us. Before I wrap up, let me go back to David Sedney. David, let me assail this issue from a different angle. Now, as you know, insurgent groups, they want to reach an optimal sort of, stage for negotiating with the adversaries, and I think the Taliban managed that. But the important thing is that I'm sure they're also keeping an eye on what's happening in the US with reference to President Trump's popularity in the upcoming elections. And they'll probably calculate that President Trump is their best, opportunity in terms of getting back into the power game in Afghanistan. And if President Trump loses the election, the new administration might revisit this entire policy. Do you think that assumption is something that makes sense, and that's going to also probably play into this as this situation unfolds?
Ejaz, it may be, but as an American, I can tell you that the people who I know here in the U.S. Are completely unsure about the future. Yes, there's a possibility that President Trump might lose. There's also the possibility he might win, as he did last time. There's a possibility he might pull all the forces out. Some news media, which is basically the same number of forces he had when he took office 3.5 years ago. I would say right now, when it comes to anything dealing with the United States, there's just a great deal of uncertainty. So that if anybody was basing their calculations on what they think is going to happen in the U.S., they could well be making a big mistake. And I think that uncertainty is one of the reasons, perhaps, why these talks have not started. We've seen Secretary of State Pompeo visit Doha once. I had a call a little over a week ago, just about a week ago, with the Taliban in Doha, asking them to reduce violence. They've essentially completely dismissed him. They've ignored his requests for reduced violence and, in fact, upped violence. So the influence of the United States right now, I would say, is rather questionable.
Okay. Thank you so much. That was Sedney speaking with us. This is all from In Focus tonight. We shall see you tomorrow at the same time. Keep following our latest updates on social media at indus.news. Good night and goodbye.